everyone. So I think most of you probably know me now, but I'm Haley. I work for Medline, so I do a lot of your education surrounding skin health. Today we're going to be focused on skincare and incontinence products. So with our skincare line, I know a lot of you were introduced to the new foaming cleanser that you'll be using before, but now we're going to roll out the full line here. So this is the Remedy Phytoplex line. Phytoplex, what that means, it means plant-based nutrition. So anything that's in these products, all the ingredients, they're all natural. There's no parabens, no sulfates, no harsh surfactants, no added fragrances. These have actually all been clinically tested, and they've really been proven to be safe for all types of skin. So when we think of, geriatric skin, especially within a home health hospice setting, they're really thin, fragile, dry skin. These products will really help nourish that skin and give it all the vitamins, antioxidants, proteins, everything that it needs to really be supple, to prevent any pressure injuries, skin tears, to basically get it to be the best it can be. So we'll start with the foaming cleanser. I know you've seen this before, but this is a no rinse foam. It is pH balanced, so it is safe for the peri area. In fact, you will probably most likely be using it for peri care most of the time, but you can use it head to toe all over the body. So this will be your primary peri cleanser, and you can use it to provide relief in between bathing all over the body as well. Then you have your purple bottle. So purple, think proper moisturization, all day, everyday body lotion. So this, we recommend that you are moisturizing your patients twice daily. If we can get that done right after bathing, that's the best. That's when the skin's pores are most open, more susceptible to taking in and retaining that moisture. And it's been proven too that if we are doing that moisturization twice daily, that it can really help reduce the instances of skin tears. So let's make sure that we're really diligent on that. And then we have our blue, so blue for barrier. So this is when you really want to pay attention to the different types of barriers and things, because it is really important to know which barrier to use for which skin condition. So our HydraGuard is a silicone-based barrier. Silicone is actually going to be more breathable, and it will last longer on the skin as opposed to a petrolatum-based barrier. I'm sure you've all seen, your A&D ointments and those types of things. This will be less occlusive, it'll be breathable. Like I said, it will last longer, and it will do a really good job at protecting from moisture damage and any incontinence associated moisture damage as well. So with this, it'll come out white, kind of like a paste, but when it goes on the skin, you just want to make sure that it's being rubbed down into that even sheer layer, so you can see that it goes on clear, but don't double guess yourself that it's there. You don't need to apply it very thick. As long as you're rubbing it down into the skin, you should be protected and good to go. So with any incontinent episode, you should always have this cleansed and then reapplied, and that will help protect from any of that moisture damage. Another thing to note about the blue barrier too, so it should be used on healthy, intact skin to prevent it from breakdown. So now we have a few more skincare items, but I want to make sure you all know that these are treatments, so they do require a doctor's order, and they will need to be applied by a nurse. So first one, we have your orange bottle, so orange for open skin. It's called Z-Guard, so it has that zinc oxide as the active ingredient. One thing to really take note of, zinc is a drying agent, so proper application as well as ensuring that you're using this on the right skin condition are very, very crucial. With zinc, this should only be used on skin that's already open, compromised, that really wet, weepy, denuded skin. This especially, you'll notice it comes out very, very thick, like a paste. But when it's applied, similar to that HydraGuard, you want it in a very even sheen layer. So if I'm applying it to my hand and you can still see that it's white like this, that's not applied correctly. You want to make sure that it's scrubbed into a very even sheen layer so that you can see right down to the skin underneath. Just like that. All right. Excuse me. All right. And then you have your 2 antifungal options. So both have the 2% miconazole nitrate. One's an ointment, one's a powder. Again, they require doctor's order. I'm sorry, I'm about to cough again. But the ointment, it's going to be really good for areas that need a dose of moisture. It even provides a nice barrier in the peri area. And then powder will be good for areas that need more moisture management. So between skin folds, the toes, under the breast, so on and so forth. With these, you just want to make sure that you use them a full 14 days through. You continue that treatment. That way we can ensure that all the fungal spores are killed off of the body and that fungal rash won't come back. All right. Any questions about the skincare?
Can you use both powder and the cream or the paste on the antifungal?
I wouldn't recommend it just because it tends to get really, I guess, gritty. It'll be a kind of weird texture that I don't think will be very conducive to healing. I would recommend just using one or the other, or if you're going to be using both, and just use them in separate areas of the body. Yeah, I just wouldn't recommend mixing them because of how that texture is, as well as the fact that you don't want to be compounding ingredients. Yeah. Okay, thank you. Any other questions? No? Okay, awesome. And you guys also have guidelines that will go through everything I just went over in case you ever need to refer to which products to use for which condition of the skin. So next we're going to be talking about incontinence products. So here, or is there one?
You're fine.
Okay, sorry. I forgot mine. So we have our Medline Fit Right Plus Brief. So this is a size large. So our sizes, we start with a small, then we have a medium. We also have a regular. This blue is large. Then we have extra large, double XL. We also have a triple XL as well as bariatric options. So we'll go over sizing in a moment, but I want you to see why sizing is so
Yeah, that does not look like a large.
Yeah.
That does not look like a large.
Say thank you so much. Okay. So, yes, no, this doesn't look like a large, but we want you to understand that our sizing is going to differ. So if you're used to a size large in another brand, this is going to be a little bit different. So we want you to get used to how these fit and how that sizing differs. So what you'll notice when I open this up, you'll notice that there's a very generous leg opening. So we designed it that way for a few reasons. One has to do with the dignity of your patient or your resident, right? So these might actually appear a little bit thinner at first, but actually we use a lot of technology, absorbent polymers and such that allow them to be more thin and discreet, but still absorb quite a bit, and probably quite a bit more than you're used to with some products. And not only do they absorb, but they really take